Hi everyone, my name is Esther Machare and I'm going to talk about management of acute hip fracture. As a definition, we have that a hip fracture is a serious injury with complications that can be life-threatening. The risk of hip fracture rises with age. Risk increases because bones tend to weaken with age, especially in osteoporosis. Multiple medications, provision, and balance problems also make older people more likely to fall, one of the most common causes of hip fracture. A hip fracture almost always requires surgical repair or replacement, followed by physical therapy. Taking steps to maintain bone density and avoid falls can help prevent a hip fracture.
The hip joint is one of the most important joints within the body. It plays a major role in bearing the weight of your entire body and provides a wide range of motion, including abduction, adduction, flexion, extension, and circumduction. The hip joint itself is what is known as a ball and socket joint, where the pelvic bone and femur come together. This joint is supported and stabilized by various muscles and carries a high density of arteries and veins. Due to the physical makeup of the hip joint, it is extremely common for bone fractures to occur if the force applied is greater than the force at which the bone can sustain. Fractures can occur due to trauma such as falling, or due to bone weakening diseases such as osteoporosis. Almost 30,000 Canadians experience a hip fracture each year. Of that 30,000, 70 to 90% is known to be caused by osteoporosis. Since the hip contains a high blood supply, early diagnosis and treatment are essential to prevent the death of bone tissue and to maintain overall health. Following a diagnosis based on an X-ray, hip fractures are usually treated with surgery through either replacing the head or neck of the femur, or in more serious cases, through total hip replacement. The risk of hip fracture increases dramatically with age and is more prevalent in women over 65. Research has shown that 1 in 6 Caucasian women will have a hip fracture in their lifetime. Several risk factors such as cigarette smoking, caffeine intake, sedatives, and inactivity can lead to a reduction in bone mass and increase your likelihood of developing a hip fracture. According to a study by Cummings et al., a history of hyperthyroidism, benzodiazepines or anticonvulsant drugs may also contribute to hip fractures. There are several ways to reduce your risk of hip fractures, especially if you are part of an at-risk group. Calcium plays a major role within the body, including strengthening your bones. By reducing calcium intake in your diet, your body begins to take it from your bones, making them weaker. An effective strategy to help increase your bone density is taking vitamin D and calcium supplements. When vitamin D is ingested, the body converts it into a hormone called calcitriol, which is responsible for absorbing calcium from your diet. In conclusion, hip fractures are a complex topic, and we have only scratched the surface of what there is to learn. Thank you for listening, and we hope that this video was informative.
You might be wondering, why are hip fractures a concern? To start, it's estimated to have a $1 billion annual economic impact in Canada. While it's mostly a concern in the elderly population, as it's most prevalent in individuals 60 years and older, it's more urgent when recognizing that Canada's population is aging. In Canada, 35,000 adults will suffer a hip fracture each year as well. But it's not just a minor annoyance in the elderly population. Hip fractures are in fact a devastating health issue for those whose bodies are just not able to recover nearly as quickly as young individuals can. 7 to 10% die within 30 days of a hip fracture. 20 to 35% die within a year. And of those that survive the year, they endure numerous long-term side effects. It's a top 10 global cause of years lost to disability, and no progress has been made in the mortality rate in the past 15 years. All of this, and it often takes up to 2 days for surgery, for these patients with a devastating medical concern, often near the later stage of their life. This is where Hip Attack comes in. Hip Attack, short for the Hip Fracture Accelerated Surgical Treatment and Care Track, is a clinical trial that is aiming to make an impact on the way hip fracture patients receive treatment. Specifically, the study is comparing the standard timeline of care, 24 to 48 hours, to an accelerated timeline of care within 6 hours of diagnosis. If accelerated surgery does indeed prove to be more effective in recovery rates as well as incidence of death, this will be an opportunity to save time, money, and most importantly, lives. The study is enrolling 1,200 patients from Canada, Europe, South America, Africa, Asia, and Australia. Researchers first began a 14-month pilot randomized control trial in August 2011, where they first collected 60 patients in Canada and India. The patients had to be aged 45 years or older and have received a hip fracture diagnosis requiring surgery during daytime working hours. In this study, the group was evenly randomized to accelerated care or standard care, in which the primary clinical outcome being observed was whether a major perioperative complication occurred within 30 days. This simply refers to any major complication and acts as a composite of cases like death, preoperative myocardial infarction, myocardial injury after non-cardiac surgery, pulmonary embolism, pneumonia, stroke, and life-threatening or major bleeding. Within the results, after 30 days, 14 patients in the standard care group experienced a perioperative complication, compared to only 9 patients in the accelerated care group, a significant enough clinical difference. Based on the data and the success of patient recruitment, the feasibility of the study has allowed for a full clinical trial in hip attack. While the initial results look promising, it's a long way to go before the study runs its course. For more information on the hip attack trial, read the full paper on the pilot trial, or the website.
Applications in medicine. Approaches to displace femoral neck fractures remain controversial, but evidence currently favors arthroplasty or internal fixation, especially in 65-year-old persons or older.
They may seem like normal occurrences, but a bone fracture, especially for older adults, may be more serious than you think. We reveal the results of a new study in today's Health Matters. You may think it's just a minor problem, but a bone fracture can signal major trouble, especially for older adults.
There's certain types of fractures that are higher risk than others.
Orthopedic surgeon Dr. Charles Springer adds hip fractures are especially dangerous.
A hip fracture in the elderly is a life-changing experience. Not only is it a single injury, but it requires typically surgery, and then to be able to recover from a large surgery such as that is often difficult.
The Journal of the American Medical Association finds that seniors suffering a fractured hip were at a higher risk of dying over the next 10 years than those who didn't.
It requires a significant amount of rehab, and some patients, whether they live in a nursing home, some are disabled to begin with, others have mental status changes, which makes rehab very difficult.
Dr. Springer says maintaining a healthy lifestyle can prevent bone fractures in the long run.
Good exercise, healthy diet, keep the excess weight off. Those things are going to be much more beneficial to you.
Since women tend to have more fractures than men, Dr. Springer also recommends that women have a bone density test to determine their risk factor. Reporting for Lee Memorial Health System, I'm John Bafar. Certain types of physical therapy can also help people reduce their risk of fractures.
The hip is actually not a bone, and we break bones. The hip is actually a joint that connects your femur bone, your thigh bone, to your pelvic bone. And a fracture at the top of the femur bone that is near the hip joint is what we generally refer to as a hip fracture. You will know you have a hip fracture if you fall and you are unable to walk. General symptoms of hip fracture are pain in the groin. Sometimes patients have some pain in their low back or their buttocks region, but generally they are unable to walk. The final diagnosis of a hip fracture will be made based on x-rays that you have. There are two general types of hip fractures that we see. One type is called a femoral neck fracture. That's a break basically of the ball and socket joint of your hip. The second type of fracture is an intertrochanteric hip fracture. That's a fracture at the top of the femur, just a little bit below where the femoral neck fracture is, and that happens in the top of the femur in the region where your major muscle groups attach. They occur about 50-50. Most of the time when we're talking about hip fractures, they occur in an older population from usually low energy falls. But occasionally the bones can become brittle and weak over time, and people can actually break their hip just from minor trauma such as small stumbles, and they'll break their hip and that will cause a fall. If a person has a hip fracture, generally surgery is recommended. Without surgery for a hip fracture, the ability to walk is very difficult and almost impossible. And more importantly than that, the ability to care for yourself is impaired. With the hip fracture, rolling back and forth, taking care of normal activities such as getting out of bed, going to the bathroom, showering, are almost impossible to do by yourself and even very difficult to do with help. So generally for hip fractures, surgery is recommended because even if you are not planning on doing a lot of walking, in order to help take care of yourself and perform your normal activities of daily living, surgery is recommended to allow that to happen.
Now we have the pros and cons. As a pro, we have that arthroplasty may be deemed appropriate in select patients, and it has no cognitive impairment and ambulates independently. And the cons, we have constipation and depenetration may cause hip fracture. Patients with a hip fracture are at high risk of venous thromboembolism.
The hip is one of the most commonly replaced joints. The problem occurs when arthritis or trauma causes joint cartilage to wear away, resulting in painful bone-on-bone rubbing. Symptoms include pain and joint stiffness and lack of mobility. Surgery, called hip arthroplasty or hip replacement, is recommended when non-surgical treatments fail. Hip replacement replaces the damaged portion of the hip with artificial implants. These devices allow for pain-free movement and mobility. Prior to surgery, you may be required to donate your own blood for transfusion. This is usually done several weeks before the operation. Let's take a look at hip replacement surgery. To begin, the surgeon will make an incision to access the joint. The hip joint is then opened to allow the surgeon to remove the damaged bone and cartilage. The head of the thigh bone is removed, which allows the surgeon to see the hip socket. Damaged cartilage and bone is removed from the socket. The implant is placed and may or may not be secured with surgical screws. The second implant is placed into the thigh bone and may or may not be secured with surgical cement. The artificial ball of the hip is then secured on top of the implant. The wound is then closed and a sterile dressing is applied. The artificial joint restores pain-free mobility. Following your surgery, you may use a V-shaped pillow between your legs while you sleep to position your hip while it heals. Your hip movement will be restricted at first to prevent your artificial joint from dislocating. During this time, you should refrain from crossing your legs, bending your hips at more than a 90-degree angle, or pointing your feet inward or outward. Physical therapists will help you exercise to strengthen your hip. At first, you will need to use a walker, cane, or crutches. You should be able to resume light activities soon after your procedure. Total healing can take from 3 to 4 months. Recovery from hip replacement is individualized. Your doctor will let you know what to expect.
Issue of binocular. We have the hip fracture is the most common type of fracture among 80-year-old adults. They are most common among females. and osteosynthesis is the most common treatment here in Ecuador. Finally, we have the conclusion. Other aspects of medical management for patients with hip fracture include prevention of constipation, nutrition, prevention of pressure ulcers, management of bladder catheterization, and blood transfusion as necessary. Thank you so much. I hope you liked the video. I find it really informative.